34-year-old Antony has been in constant pain for the best part of a decade. He's one of more than 15 million people in England that live with a long-term condition, ranging from asthma to Parkinson's disease. Whilst working in the Navy, Antony had various operations on varicose veins in his legs, which damaged the nerves, and he was left with neuropathic pain in both his legs and hips.
The varicose veins, they come up and they weren't too problematic, but they were quite large, and the ship's doctor said I could have them removed. I had the veins removed. Unfortunately, the veins come back quite quickly. It now transpires that they actually cut in the wrong places, so I'm not quite privy to all the technical details. But they operated again. Unfortunately, the second time they didn't arrest where the leaking veins were coming from, and caused nerve damage at that surgery. The pain can be instantaneous, so movement does cause the pain to increase. But sometimes it's not instantaneous. It might catch up with you later that day or the next day. So you could spend a day thinking, oh, I feel all right today, and you run around the garden and you play catch up on all the jobs that you haven't done that week because you've been ill, only really to store the problem up for the next day, where you could put yourself in a situation where you're bed-bound or stuck on the sofa.
I mean, we've been listening to people with long-term conditions saying, actually, we want to take more control and have more decisions. We know about our body and we know about our conditions. And so Your Health, Your Way has really been about bringing together the things that the government has heard people say they want. They want more information that they can get more easily. They want support from healthcare professionals when they want it. They want sometimes equipment and tools to help them live. They want to be part of support groups, and as part of all of that, the government is making sure that anybody with a long-term condition by 2010 will have their own personal care plans offered to them, so that the person concerned and indeed the healthcare professionals are clear, who's going to do what around their healthcare.
I got to a point where I actually found that the medication was probably just as disabling as the pain was itself. I found it very hard to think clearly. So I spoke to my GP and he was very supportive, and I said, is there anything else? I want to start taking control, what can I do? And in the surgery I found a leaflet for a self-management course called the Expert Patients Programme. And I went on this course, and there I learned about all the different factors that affect my health. So I learned that if I get stressed, it can tense my muscles and increase my pain level, and how stress and tiredness can affect it.
This is about saying to the whole system, in terms of healthcare professionals, this is what we need to do. And it's also making people with long-term conditions that perhaps aren't aware of what's on offer for them much more aware, so they can get the information from their GP, their nurse, their pharmacist, or if they want to, and they've got access to the internet, they can go online at nhs.uk/yourhealth.
Having the website, it's like having a GP in your living room, isn't it? You can go look, find information out. I can then look at that information and incorporate that into my own long-term planning, so I know how to use it. I know what to expect with side effects and stuff. But I can also see, okay, if this is my condition, what support groups are available. So I'm really taking control myself, so I'm not relying on other people. And what it's doing is promoting self-efficacy. 1 in 3 of us have got a long-term condition, and if we can improve the lives of those people, then it's got to be a good thing.
The Department of Health says it has a strategy for improving care, services and health outcomes for people with long-term conditions. It's told us it aims to ensure that people are listened to, given more information about their condition, and that they're supported to do more for themselves to take control of their own health and well-being.